Before we dive in, let's take a moment to think about something. When people talk about antidepressants, medications like Prozac, Zoloft, or Lexapro often come to mind first. They're widely prescribed, well-known, and commonly discussed. But what about the lesser-known options? Sometimes, effective medications don't get nearly as much attention, despite offering unique benefits for certain individuals. One of those under-the-radar options is mirtazapine, also known as Remeron. You might have heard of it in passing, or maybe your doctor mentioned it as an alternative to SSRIs or SNRIs. But what exactly makes it different? Why do some people swear by it for sleep and anxiety, while others are concerned about side effects like weight gain? That's exactly what we're diving into today. In this video, we'll break down everything you need to know about mirtazapine, what it is, how it works, its benefits, risks, and everything in between. By the end, you'll have a clear understanding of whether it might be the right fit for you or someone you know. So mirtazapine is an atypical antidepressant, meaning it doesn't work the same way as other traditional antidepressants like SSRIs and SNRIs, and is FDA approved to treat major depressive disorder. Unlike SSRIs and SNRIs, which work by reuptake inhibition, mirtazapine functions differently. Mirtazapine belongs to a group of medicines called tetracyclic antidepressants, also known as TCAs, known to block serotonin receptors 5-HT2 and 5-HT3, which is a key part of its mechanism of action as an antidepressant. It acts as an antagonist at these receptors, effectively preventing serotonin from binding to them and thereby increasing the availability of serotonin in the brain. This is an antidepressant that also blocks alpha-2 adrenergic receptors. This action increases the release of serotonin and norepinephrine, which can help with depression. Another major effect comes from blocking the histamine H1 receptor, leading to sedation. That's why mirtazapine is sometimes prescribed for sleep issues. Lower doses tend to enhance sedation, while higher doses reduce drowsiness and primarily target mood. It's also been found useful in treating irritable bowel syndrome with diarrhea. Mirtazapine increases the extracellular levels of noradrenaline and serotonin. So remember, mirtazapine has sedative, antiemetic, and appetite stimulatory effects. Mirtazapine is primarily used for major depressive disorder, but it's also prescribed off-label for conditions like anxiety, PTSD, and insomnia. Sedation and anxiety relief can occur quickly at lower doses within days. However, the full antidepressant effect typically takes 2 to 4 weeks, sometimes up to 8 weeks. Patience is key. Quick question. How many of you are watching this video late at night? Be honest. If you are, you might just be the perfect candidate for mirtazapine. I see you, fellow night owls. That being said, before considering this medication, it's important to be aware of its safety profile. For starters, mirtazapine carries a black box warning for suicidal ideation, especially in individuals under 25. Common side effects include sedation, increased appetite, weight gain, and dizziness. About a third of users experience noticeable weight gain. Less common side effects include dry mouth, constipation, and sexual dysfunction. Rare but serious risks include abnormal white blood cell counts, photosensitivity, and elevated liver enzymes. Compared to other antidepressants, mirtazapine is less likely to cause nausea, vomiting, or sexual dysfunction, but more likely to cause drowsiness and weight gain. Mirtazapine is metabolized 3A4, 2D6, and 1A2, meaning drug interactions are a possibility. Avoid combining it with MAO inhibitors due to the risk of serotonin syndrome. Also, be cautious with medications that lower the seizure threshold. Alcohol should be avoided as it can increase sedation and impair cognitive function. While not considered addictive, stopping mirtazapine abruptly can cause withdrawal symptoms such as dizziness, nausea, anxiety, and insomnia. To minimize withdrawal effects, a slow taper over several weeks is recommended. Mirtazapine is a powerful option for treating depression, anxiety, and insomnia. However, weight gain is a common concern. It's often used at low doses for sleep and appetite stimulation, or in combination with other antidepressants for enhanced effects. Look, hitting the like button won't make you a genius overnight, but it will help the YouTube algorithm show this video to others who might need it. So do your good deed for the day. Like, subscribe, and share this video with a friend. Alright, let's put your knowledge to the test. with 3 challenging mirtazapine questions. Think carefully before answering. First question. Mirtazapine exerts its antidepressant effects primarily through A. Inhibition of serotonin reuptake via the SERT transporter, B. Antagonism of 5-HT2A, 5-HT2C, and 5-HT3 receptors, along with alpha-2 adrenergic blockade, C. Selective inhibition of monoamine oxidase A, MAOA, D. Direct agonism of the 5-HT1A receptor. The correct answer is B. Mirtazapine works differently than SSRIs and SNRIs. Instead of inhibiting serotonin reuptake, it increases norepinephrine and serotonin levels by blocking presynaptic AF2 receptors. Plus, its antagonism of specific serotonin receptors like 5-HT2A, 5-HT2C, and 5-HT3 reduces side effects like nausea and sexual dysfunction. Did you get it right? Next up, which of the following pharmacokinetic properties is incorrect regarding mirtazapine? A. It is primarily metabolized by CYP3A4 with minor contributions from CA2D6 and C1A2. B. Lower doses, 7.5 to 15 milligrams, tend to be more sedating due to greater histamine H1 receptor antagonism. C. Mirtazapine has a high affinity for dopamine D2 receptors, contributing to its antidepressant effects. D. It has a relatively long half-life, ranging from 20 to 40 hours, allowing for once-daily dosing. If you chose C, you nailed it. While mirtazapine does influence dopamine indirectly, it does not have a high affinity for dopamine D2 receptors like antipsychotics do. Instead, it enhances dopamine release in certain brain areas via its noradrenergic and serotonergic mechanisms. This makes it less likely to cause extrapyramidal side effects compared to drugs that strongly act on D2 receptors. Okay, here we go. Another question. Mirtazapine's sedation effects are primarily due to its action on which of the following receptors? A 5-HT1A receptor agonism, B. Histamine H1 receptor antagonism, C. Alpha-1 adrenergic receptor agonism, D. Dopamine D2 receptor antagonism. Got your answer? Let's see if you're right. If you chose B, histamine H1 receptor antagonism, you nailed it. Mirtazapine is highly sedating at lower doses because it strongly blocks H1 receptors. That's why doses around 7.5 to 15 milligrams are often used for sleep. But as you increase the dose, the sedative effect actually reduces, since other mechanisms kick in. Let me give you a quick breakdown on this one a little further, because it may have thrown you off. A. 5-HT1A receptor agonism. Mirtazapine does not directly activate this receptor, though it increases serotonin here indirectly. C. Alpha-1 adrenergic receptor agonism. Mirtazapine actually blocks alpha-2 receptors, leading to norepinephrine release. This is more stimulating, not sedating. D. Dopamine D2 receptor antagonism. Unlike antipsychotics, mirtazapine does not block D2 receptors, so it doesn't cause dopamine-related sedation or motor side effects. How did you do? Let me know in the comments. And if you want more psychopharmacology, don't forget to like and subscribe. See you next time.